Welcome back. 1 in 7 men will develop prostate cancer in their lifetime. 3% of those men will die from it. But there is some good news. It is relatively treatable if it's found early enough.
Yeah, fortunately, there's robotic technology that allows surgeons to remove the cancer while saving structures they couldn't always save in the past. Whitney Amon explains the process surgeons at McLaren, Northern Michigan can now use for today's In Good Health.
Michael Greer is healthy, active, and loves spending time with his family and walking his dog.
I had a friend say to me, "You're the most healthy person I know." And I said, well, apparently not, because I have prostate cancer.
A diagnosis no one wants to hear.
A couple months ago, I went in for my annual physical, and I had an abnormal result for my PSA. My blood test was a little bit elevated.
It is completely clinically asymptomatic, so the only way for us to reliably figure out if somebody has prostate cancer would be through getting a PSA on that blood test. And so we're looking at the number, but more importantly, we're looking how that number has increased over the past couple of years.
After meeting with Dr. Roloff, a biopsy showed cancer on half of Michael's prostate.
I guess I anticipated potentially the worst, since I am the king of worst case scenarios, my wife tells me. But it's a little bit alarming and kind of a kick in the gut, so to speak.
Then it was time for Michael to hear his options.
At that point, I remember saying, okay, where do we go from here?
It's really based on grade and severity of the disease. And so when you get a prostate biopsy, you're given a score. It's called the Gleason score.
Based on that score, patients are put into different categories: low, intermediate, and high risk, to determine the best treatment option.
Treatment options include surgery, robotic surgery, open surgery, radiation, hormonal therapy, freezing therapy, cryotherapy, and some other experimental therapies.
Fortunately for Michael, a robotic prostatectomy was an option for him.
Essentially a surgeon-controlled robot that has 4 separate multiplanar arms that come over the patient, and the control is completely surgeon-oriented, and we're able to use these 1/2-inch instruments to assist us in identifying all of these structures and save structures that we wouldn't in the past have known were even there.
Benefits include decreased blood loss, a shorter stay in the hospital, getting back to normal activity sooner, and minimal pain medication.
I was back to work within a week and a half. Working shortened days. It's not completely debilitating for your life. There is life afterwards.
There are some concerns men may have with any prostate cancer treatment.
There are 2 main things that will be affected in their life, and one of them is erections, and the other one is incontinence afterwards.
Dr. Roloff says after the robotic surgery, 95% of men will regain complete continence within 1 year. This kind of surgery also allows him to visualize structures they didn't know were previously there.
The nerves run right alongside the prostate, and based on a patient's pathology, the grade of their disease, the severity of the disease, and where it's located, we'll attempt to spare those nerves.
Thanks to the robotic prostatectomy and a great support system, Michael is becoming more active every day and back to walking his dog.
I think sometimes there's a stigma around prostate cancer being, oh, well, at least you only have prostate cancer and that's treatable. But it's still a cancer, so I just, once again, think we're fortunate that diagnosis doesn't mean it's the end of the world. Hopefully it means a new beginning, which it is in my case.
For In Good Health, I'm Whitney Amon.